Well, joining me now to look at the challenges and the concerns as Canadians await the approval and the arrival of a vaccine is Kerry Bowman. He is an assistant professor of family and community medicine at the Faculty of Medicine at the University of Toronto. Professor Bowman, thanks for joining us.
Happy to be here.
Let's start with what's for you as someone who looks at the ethical, the community health issues connected with vaccines. What's the biggest unanswered question for you about this vaccine situation as we wait for a vaccine?
When are we going to get it? I'm going to be honest with you. I'm more worried this week than I was about 10 days ago or a week ago. And here's why. We don't have production capacity. I suspected this, but we all know that for sure now. So there's some very good news, and we know, most of us know that good news. We're contracted with 7 potential vaccines, 3 of which appear to be showing really high efficacy. Wonderful, wonderful, wonderful as a starting point. But when are we going to get it? So if we don't have production capacity, we have contracts. Our government is not telling us what those contracts actually say. Now, they're saying we can't. I don't know if that's true or not, but what do the contracts say? So as much as people have tried, media and others, we need a date, we need specifics for planning. It's not forthcoming.
The government is saying, though, that they feel relatively confident that the contracts as signed do entail a commitment by the international pharmaceutical companies to deliver for a certain date. And they're saying, January to March, we'll see 6 million doses from 2 companies. You're not as optimistic.
Yeah, when I look to the language, what I've seen in writing, I'm seeing language like as many as. Okay, so as many as, when you really think of it, it doesn't say anything other than the upper limit. That could be almost anything. And what worries me, and look, I hope I'm wrong, and I hope I'm worrying too much. But here's what worries me is, countries that are producing and that have discovered and are in production, like Germany and Britain and the United States, are they really, really going to be forwarding, these massive amounts of doses to other countries when their own people haven't had full inoculations? And I hope they will. If we knew what these contracts actually said, it would be very helpful. And look, here's the other thing. It's so wonderful that we're pulling in our military. No one knows more about deployment than the military. And Canada has almost unique challenges with our ratio between, people to land size. So does Australia, so does the Russian Federation, but we've got our challenges. And they're experts on deployment. But look, they need to know, and the provinces need to know, and the territories need to know what is the timeline, how many doses, and the nature of the vaccine. Because remember, we're hearing that 1, maybe 2 of them are going to need profoundly deep refrigeration. So they need to know these facts. The other thing is, one vaccine, maybe, well, that one's really the most beneficial, for people within this age group or medical profile. This one isn't. So all of the planning that we're asking our military and the provinces and the territories to do, their hands are tied until they have the facts before them as to what the timeline is, numbers, type of vaccine, etc.
Okay, let's look at the other issue. A lot of people are saying it's a bit of a no-brainer that the first doses will go to top priority groups. So you're looking at, for example, frontline healthcare workers. You're looking at what they call communal living centers, especially long-term care homes, and you're looking at Indigenous populations who are especially isolated and vulnerable. Does it get more complicated once we pass that? Let's assume we get the vaccines from January to March, and then it starts flowing. You've dealt with the ethical decisions about vaccine distribution. What is faced by governments after those target groups are hit?
Yeah. So look, we have broad consensus on those target groups, as you very clearly described them. There's broad consensus, there's not pushback, and that's a wonderful thing. But then it gets much more complicated. So then we have other vulnerable groups. We have racialized communities where there's clear evidence. And then there's this dance between kind of epidemiology and ethics, not saying those are separate and they can't be combined. But look, some people are saying, let's find all the partying 25-year-olds, which is a stereotype, I realize, but, and vaccinate them because they're going to keep it from spreading. And if we look at it economically, people could say, well, all these small restaurants, as one example, across the country that are on the verge of going out of business, let's, inoculate them and their staff so that they can open up rather than the chains. Are we going to have some kind of economic triage with with vaccination. So that's where it gets much more complicated. So the big stuff, I'm not suggesting it's going to be easy, but we've got broad consensus on, and that's good. Not all countries do. But it's the smaller stuff that we are going to have to figure out. And you know what I do believe is there will be variation between the provinces and territories. Even as Canadian senior citizen, like what's that, right? We all know what it is, but what age is that? We don't all agree on what age that is. So, there's going to be differences.
Okay, well, listen, something tells me this won't be the last discussion we have on this, especially as the vaccine starts to be distributed across the country. I want to thank you very much for speaking with us.
You're very welcome. Thank you.